The value of science is being challenged. Budgets for scientific research are being slashed, and a lot of research has been deemed wasteful. Meanwhile, recent surveys show public trust in scientists has dropped sharply, particularly among conservative voters compared to pre-pandemic levels. Unfortunately, the scientific community shoulders some of the blame, and one of the greatest contributing missteps was the very phrase meant to help: follow the science. That's the topic of this week's Healthcare Triage. This episode of Healthcare Triage has been adapted from an editorial I wrote for the Washington Post. Intended to inspire confidence, follow the science was commonly heard at CDC briefings and as part of Biden's pandemic plan. But science is evidence, not instruction. Treating it as something definitive to be followed shut down dialogue and dismissed critics as anti-science, which alienated a lot of people. To win back that trust, we need a new model of communication. One that clearly separates science from policy and is honest about what science can and can't tell us. Science explains the facts as we currently understand them. Sound public policy, on the other hand, involves choices and trade-offs, balancing what we know, what we can reasonably predict, and what outcomes we want to achieve. For example, studies tell us that vaccines are unmatched in preventing many communicable diseases. They also tell us that undercooked eggs carry a risk of salmonella. These are two scientific truths that underlie very different policy responses. One may justify mandating vaccines in schools. The other certainly doesn't justify banning sunny-side-up eggs. Why? Because there's a lot of nuance to consider when drafting policy based on data. Such nuance was often glossed over during the COVID-19 pandemic. For example, at some point, health authorities settled on 6 feet of distance to limit viral spread. Why not 5, or Europe's 1 meter? Digging into the literature, as many did, yields very little evidence justifying that number. It seemed more like a guess or a compromise, yet it was repeatedly presented and received as an absolute truth, essential and non-negotiable. Even when challenged, officials rarely acknowledged the trade-offs of rigid public health guidance. In a 2021 press conference, for example, CDC Director Rochelle Walensky was asked directly where the 6-foot number came from and whether it had been studied alongside masking. She reaffirmed that the number was based on prior studies and said CDC was revisiting the guidance, but didn't concede it might have been arbitrary, despite the burden it placed on schools and communities. That rigidity turned people's healthy skepticism into angry defiance. In much of that communication, follow the science became a cudgel to dismiss criticism of policy as anti-science. But science rarely offers a single uncontested answer. Officials could build more public trust by distinguishing evidence from policy and by acknowledging that the same data can support different reasonable interpretations. This brings us to another shift that's badly needed: openly admitting the limits, uncertainty, and complexity of scientific evidence. Take, for instance, a 2018 study on alcohol's health impacts published by The Lancet, and we've talked about this before. The authors found that drinking even 1 serving of alcohol each day significantly raised the risk for certain diseases and suggested that, from a purely scientific perspective, there was no safe level of alcohol consumption. Headlines blared this sentiment, drawing anxious clicks. We looked at the same paper and came away with a very different perspective. If you took 100,000 people who drank no alcohol, 914 of them could be expected to develop one of these associated diseases the following year. If another 100,000 people drank 1 alcoholic beverage daily, the number rose to 918, a difference of just 4 people out of 100,000. While excessive drinking substantially increased those risks, moderate consumption appeared to carry minimal additional risk for most people. Both of these perspectives are based on the same study and the same data. Which one follows the science? By misrepresenting scientific uncertainty as certainty, we forfeit public trust. Communicating science as rigid, top-down rules rather than nuanced guidance sows confusion and skepticism. Science itself shows this to be true. That's partly why trust has steadily eroded in public health officials, institutions, and even in science itself. The 2025 Edelman Trust Barometer noted, and I'm quoting, "In health today, expertise alone no longer guarantees trust." Surveys from the Pew Research Center find that while most Americans believe science benefits society, they are skeptical of how it's used in policymaking. Without trust, more information doesn't solve the problem, it often makes it worse. Studies show that emphasizing fact-based corrections without restoring trust paradoxically entrenches false beliefs. When people who strongly believed the flu shot caused the flu were given corrective information from the CDC, they became less likely to be immunized. As a pediatrician, I was taught to communicate with patients and parents openly and without judgment, recognize complexity and uncertainty, and build trust patiently, one conversation at a time. Public communication about science deserves the same. Repairing trust won't happen with slogans or sound bites. To redeem it, our model must be based on 3 key principles: communicating through empathy rather than fear, transparency rather than false certainty, and humility rather than authority. That means rebuilding dialogue, transparency, and respect over time. It also means reckoning honestly with mistakes, including overusing "follow the science" when science alone rarely dictates what we should do. Hey, did you enjoy this video? You might enjoy this previous video where we really got into that alcohol study and discussed its various pros and cons. We'd really appreciate it if you'd like the video, subscribe to the channel down below, maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Lilliholm and Joshua Crow, and of course, our Surgeon Admiral, Sam.